By management of polytrauma patients, it's related to all the orthopedic emergencies that we just mentioned. The most important thing to understand is advanced trauma life support with its 3 phases: primary survey, secondary survey, and tertiary survey. So primary survey, it's very important to resuscitate the patient in this phase. And then secondary survey is provisional and definitive care. Tertiary survey is reassessing the patient once his conscious level is improved. So primary survey is A, B, C, D, E. A is airway, B is breathing, C is circulation, D is disability, and E is exposure. There are some adjuncts to do with the primary survey, and these adjuncts are chest X-ray to rule out any life-threatening chest injuries, epipelvic X-ray to assess for any pelvic fracture, insertion of Foley catheter, gastric tube, and also doing the fast ultrasound, which is focused abdominal ultrasound to assess for any problems or any intra-abdominal bleeding. Secondary survey is complete head-to-toe examination and survey. In this phase, you add additional radiographs, plain X-rays, CT scan, and also you can add some lab tests. Tertiary survey is the last thing, and this is usually completed once the patient's conscious status is improved. So complete head-to-toe survey, important for orthopedic surgeons to avoid missing injuries. So in a study, they found that 12% of injuries in polytrauma patients are missed in the first 24 hours. So that's why you need to follow standardized tertiary survey, because that has been shown to decrease the rate of missed injuries by 36%. So what's your priority when you assess patients or evaluate polytrauma patients? Priority is to save their lives, then save a limb, and then maintain the function if possible. Orthopedic emergencies also should be managed in the context of polytrauma based on these priorities. So what are the orthopedic emergencies? Open fractures, compartment, vascular injuries, joint dislocation, and stable pelvic fracture. So we already talked about this. So this is an open fracture. It's very important to give antibiotics to avoid an infection. Gastillo classification is very important to help us in guiding the antibiotic treatment. Cephalosporin for grade 1, grade 2 you can give cephalosporin with Genta, and grade 3 you can give both plus ampicillin if there is soil contamination. As we mentioned, early administration of antibiotics is very important. Compartment syndrome, also we know that pain out of proportion is the most important thing. You have to do it as soon as possible to avoid muscle necrosis. If you have a delayed presentation of compartment syndrome, then it's better to avoid fasciotomy to avoid having infection. So treatment, remove splints, place extremity at level of the heart, and emergent fasciotomy is very important. Vascular injury, as we mentioned, can happen from blunt or penetrating injury. Just control the hemorrhage, realign the limb, splint. Further evaluate by checking the distal pulses, ABIs, CT angio or angiogram also can be helpful. If you have vascular injury with a fracture, you need to fix the fracture first quickly, and then the vascular surgeon will repair the injury. Joint dislocation, very important, we just talked about it. And the most common or the most serious is the knee dislocation, so you have to consider popliteal artery injury. Have to realign the limb or reduce the limb as soon as possible. Assess neurovascular status and do all the vascular assessments. This is an open book pelvic fracture. You can see they close it down with a binder to decrease the volume. And as we mentioned, resuscitate the patient. If there's no response, maybe you should consider sending him to the OR for XLAP, open the belly and look for bleeding, or send him for angio to do embolization. So the main concern in polytrauma patients, you want to avoid having what's called multi-organ failure or acute respiratory distress syndrome. And this usually happens once the patient reaches, a level of release of inflammatory markers. They will have something called systemic inflammatory response syndrome that will lead to generalized inflammation in the systems and multi-organ failure. The most important thing is ATLS with the 3 phases of ATLS each phase. What's the most important things? طبعا أعطيكم بريك 10 دقائق